A lot of people assume that if they have back pain, they need a scan, an MRI, an X-ray, something to show exactly what's going on. It feels like the logical next step. But in most cases, a scan is not needed, and more importantly, it often doesn't change what actually helps. Back pain is very common, and in the majority of cases, it improves with time, movement, and the right approach. The issue with scans is that they often show changes that sound serious, but are actually very common. Things like disc bulges, degeneration, or joint changes. These can sound concerning, but they're frequently found in people with no pain at all. So seeing them on a scan doesn't necessarily explain why you're in pain. This is where a lot of confusion comes from. People see something on a report, assume it's the cause, and then start to worry. That worry can actually make things worse. It can lead to fear of movement, avoidance, and reduced activity, which over time can slow recovery. This doesn't mean scans are useless. They have an important role, but that role is specific. Scans are usually recommended when there are signs that something more serious might be going on. Things like significant trauma, progressive weakness, changes in bladder or bowel function, unexplained weight loss, or pain that is not improving at all over time. These are often referred to as red flags. In those situations, a scan can help guide further investigation and management. But outside of that, scans are not usually the starting point. Good assessment is understanding how the pain behaves, what movements affect it, how it's changed over time. That information is often more useful than a scan. Another important point is that scans don't predict recovery very well. Two people can have very similar scan results and very different symptoms, and people with significant findings can recover well, while others with minimal findings can still have pain. So the focus should not be purely on what a scan shows. It should be on how the body is functioning. Movement, load tolerance, strength, consistency. These are the factors that drive recovery. A scan doesn't change those. In fact, in many cases, having a scan too early can lead people down the wrong path. More worry, more avoidance, less movement, and slower progress. The key takeaway is simple. Most back pain does not require a scan. And in many cases, you're better off focusing on recovery first, but knowing when a scan is appropriate is important. That's where proper assessment and clinical judgment come in.